today. So we're going to get started. I know that there'll still be people signing in, but they'll have an opportunity to see the FAQs and to be able to watch, or in some cases, some of you may want to rewatch this time together. We are recording so that we can make all of the information available to anyone who may need it. So I know that you probably are fully aware that we are on this journey to replace our crisis continuum of services in our community. In the few months that we have been without them, we have certainly heard from our community that there is a significant need for very precise and experienced crisis services to be available for people who are struggling. One of the things that we have had the privilege of doing over the last few months, however, is also being able to go into neighborhood, to go into community meetings, and to really hear from those who are end users of these services what they need. And that was at the request of our Board of Trustees to go in and to listen to the needs of providers, of law enforcement, of a variety of stakeholders who are part of the system. And we especially heard from end users, and we both are sensitive to and resonate to the stories that they shared with their struggles sometimes in making sure that their loved one or that they themselves was able to receive a service that met their needs in that special moment of crisis. So we're going to take some time today to talk to you about what we are putting into place with our RFP. It will be posted for you to be able to have an opportunity to view. And certainly if you have questions, we want to encourage you to ask them here or to be able to, and you'll get information on this, reach out to us to get those questions asked. And as we receive questions, we'll be posting them so that others have the ability to see those answers as well. Because if you have a question, it's likely that someone else may have that same question. So with that said, welcome. And I am going to ask Kimberly to jump in and begin to talk about the specifics of this process.
Thank you, Helen. Good morning, everybody. And for those of you that do not know me, my name is Kimberly Priester, and I'm the Director of Treatment and Supportive Services with the Montgomery County ADAMHS Board. And I'm going to share with you some of the things that we are looking for. Tina, are you pulling that up on the screen? Okay. So while Tina's doing that, I do want to share that, as Helen stated, we are seeking proposals for the delivery of the crisis services in Montgomery County. And we will provide to you in the RFP, there is a link that gives you the national guidelines for behavioral health crisis care. It's the best practice toolkit. And you'll see right there on the screen that if you click on that link, it will take you to the page that will talk you through the best practices for crisis call center, mobile crisis response, as well as the crisis receiving center. We are keeping this request for proposal fairly broad because we really are looking to see what some of your creative ideas are. So all proposals, though, should include a plan to create business agreements with the providers in our community. And we also are looking for some information on how you plan to coordinate relationships with local law enforcement. So we do have our minimum requirements, as you can see, that are listed on this page. For the crisis call center, we do request that this is operated Monday through Sunday from 8 a.m. to midnight. It does need to be staffed with clinicians who are overseeing clinical triage and other trained team members to respond to all the calls that are received. Answer every call or coordinate overflow coverage with a resource that also meets all the minimum standards that are in the toolkit that previously was mentioned on the previous page. It's important to assess the risk of suicide in a manner that meets this standard. And it's also important to coordinate the connections with local providers, and that ties into the business agreements that was also mentioned on the previous page. One of the things that we've learned from previous experience is that it's important that the providers are notified if one of the individuals that is being served in a moment of crisis, that provider is notified so that there's that continuum of services and that continuation of care. We also are requesting for the mobile crisis response that this includes an individual that has a license and is capable of assessing the needs of that individual when they go out to do that crisis response. This could be in person or telehealth. It's important to respond where the person's at. That could be home, work, it could be at a park, obviously keeping in mind HIPAA. But we don't want to restrict the services to Monday through Friday. Connect individuals to facility-based care as needed through warm handoffs. And we also think it's important, and as you look at the best practices for crisis services, that you incorporate peers within the mobile crisis response team. As most of us know on this call, peer support is so important. It's so important, and it helps individuals that are in crisis feel heard, feel supported, and like someone that's gone through something similar to them is there in their time of need. And then it's also important to schedule those follow-up appointments, similar to what we would do with a warm handoff. And that ties back in yet again to those business agreements and that continuity of care. If that individual already has a provider, let's make sure we get them connected back with the therapist or case manager or doctor that they're already seeing. And then we also have on here the Crisis Receiving Center, being able to accept all referrals and designing services to address mental health and substance use crisis issues. Being staffed with a multidisciplinary team that's capable of meeting the needs of individuals that are experiencing all levels of crisis in the community. So it's important that there's a psychiatrist, potentially nurse practitioners. Also, you see in parentheses, we have telehealth because we really are looking at really all of the creative options that are available to us. You also see there's nurses, licensed clinicians, once again, that are capable of assessments. And once again, peers with lived experience are so important. And we have seen some phenomenal peers step up over the course of the past couple months. After the crisis services had left our community, we have some great peers that have just been doing a phenomenal job connecting with people in our community and offering support. Also, you see there's the walk-in, first responder drop-off options, the screening for suicide risk, and then also screening for that violence risk as well. So I want to be able to pass this then to Emma Goldinger. Emma is the program coordinator who manages quality. She does data, she does our outcomes. And so I'm going to pass it over to Emma because she's going to share with you guys the process of how to apply for this and the different steps if you're already an organization that we work with and that has already applied for previous funding, or if you're brand new to this process. So Emma, I'm going to pass it over to you, and there you go.
Hi, everybody. As Kimberly introduced me, my name is Emma. I do quality improvement here for treatment and supportive services at Adamus. So just want to walk you guys through how to apply and what our portal looks like. So we use Seabrooks for our application portal. If you applied in the CY24 cycle for either or SFY24 or 25 for prevention or treatment, you've been in this portal, you know what it looks like. So if you have already been in the portal, you're just going to use your same username and password that you used for the last AFF cycle. If you have any questions, you can always reach out to me. I can help you reset your password. But just make sure that you're on the Adamus specific website if you and you'll see like the agency site right here. If you are a new provider and you need to create a new agency, you're going to go to that same login page that the link above takes you. And then you're going to click request a McAdamus provider portal account. You're just going to follow the instructions. It's super simple. They'll just have you enter in, you know, your main contact, your EIN number, and like your facility's address and whatsoever, and then it'll get you set up. Next, so once you're logged in, your homepage will look something like this. And you will see on this left-hand side here, you'll see it says test Adamus because that's our test site. And then you'll see apply report. I want you to scroll down. You'll see these dates. You're going to see treatment and support, and you'll see CY25. And that's where you'll click on this application for funding for crisis services. Once you're in the application, it will look like this. You have your submission deadlines, instructions. I do want to pay extra attention over here to the right-hand side down here. If you see this little plus sign, that's where you're actually going to put in your program. So there is a minimum of one program when you're applying. So you'll just click that little plus sign, create your program. It will send a request to me that you want to add that program. I'll accept it, and then you can continue on with your application. Once you get that program in, it will look like this. That first pink row will be all of your organization-specific information. So your financial information, agency assurances, facility schedules. And then the next pink row is going to be your program specifics. That's where you can put in your narratives, your program budget, and all of that good stuff. And then I do want to pay special attention in that first, you'll see the support documentation. Once you click on that, this is kind of like what it will look like. There's an area for all of the documents that we need from you guys. You can upload those. So things like your list of board members, your table organization, your last financial audit. And then we did add at the very end additional documentation. So there's just 2 spots where if there's anything that we don't specifically ask for, that you can upload there, and then you can put a little description of what it is. So anything that gets put in there, we will also review. And then the last thing I want to pay some extra attention to is in your programmatic section here, there's going to be 2 places you're going to be uploading budgets. So the second to last, the program budget summary is going to look like this, where you're just going to put it into our system and it automatically grabs it and compares it with other applications. And then the next one is program budget upload. So you're actually going to be uploading your summary twice. So the program budget upload is going to have a spot where you can upload an Excel sheet. The Excel sheet will have 2 sheets. One will be your summary and one will be a more detailed line item budget. So like I said, that first sheet on the Excel, the summary is going to mirror exactly what you're going to put in here as well. And then we do ask that you use our budget template for that Excel sheet. You can find that here in our resource center. When you looked for the crisis application, you scroll all the way down to the bottom, there's the resource center. You're going to click on application for funding materials, and there will be a treatment supportive services budget template there for your use. That's all I have for you. It's pretty standard. We do have a tutorial that I recorded on how to fill out the application that we can put up on our website for you guys to utilize as a tool. And as always, if you have any questions, you can contact either my direct email or you can contact support at McAdamus.org. I also get those emails. So just let me know if you guys have any questions. Thank you. I'm going to pass it back to Kimberly.
Thanks, Emma. And I'm just going to, Emma, when is the portal opening?
It is opening tomorrow morning at 9 a.m.
Okay, great. Thank you for that, Emma. And I'm actually now going to pass it to Tina because she's going to share some information on where you can find these PowerPoints and any of the information. And I'm also going to pass it to Tina to talk about an FAQ page that we will have. So Tina.
Thank you. So I think most of you, I'm looking around the screen, I think most of you are fairly familiar with our process when we do applications for funding. I am going to share my screen and show you where on the website you can find this information. We created, see right here, this request for proposal countywide services tab right underneath the header of the website. You will click on here, and within the hour, all of the information we're talking about will be right here. We will have the PowerPoint that Emma just shared. We will have the full application and request for proposal, so you can see all the details. We will have the FAQ document here. Everything you could ever want to know to get the information about this process will be right here on the tab. The reason we're differentiating this tab is because you also know we're in an application for funding process for calendar year 2025. That will be this box right here. So it's a very clear delineation where you're going to go to get that information. So I hope that's helpful to you. We will have that full document there within the hour, and you can send your questions to Emma. You can send your questions to me as well, because as you know, through this process, any question that is asked of us, we will answer it. We will put that in writing, and it will be part of the FAQ document that everyone has access to. I hope that makes sense. Okay, let's open it up to see if anybody has any quick questions here. I know you're going to need time to digest the document, but does anybody have questions on the process right now? Anything? Is this profit open to for-profit agencies? Kimberly, would you like to take that?
Sure, thanks, Tina. So yes, absolutely. Anybody can apply for this. We have it, when you look through the RFP, you will see that there are certain allocations of dollars that are not set aside for for-profits, but overall, as a whole, anyone, a for-profit, a nonprofit, can apply for these services.
And I did just drop the document into the chat. I know you guys are all very anxious to take a look at it. And as Kimberly mentioned, I do want to reiterate, we didn't want to box anybody in. We're looking for innovative, creative ideas. We heard that in our community meetings, that our community wants us all to be very open to the freshest, newest ideas that are out there. So the RFP is very simple, following the national best practices and guidelines. And so we're looking forward to seeing your creativity. Any other questions?
Tina, this is Lisa. Good morning. Appreciate all this. And maybe I have missed this, and I, certainly outside of here, be reviewing all the documents. Is there, and this may be more of a Kimberly question, do we understand at all what budgetary, the financial amounts are available, or how you all are, wanting us to attend to that piece? I mean, I know we'll put together budgets if we're applying those pieces, but I do have to ask that about funding from your all's perspective. Thanks.
So I'm actually going to pass that to Helen or Chrissy, but thank you, Lisa.
Thanks, Kimberly.
So I would say to all of you is, and you know that we are in a period right now of reduced budgeting, so we only have dollars that are available to us currently from SAMHSA grant, as well as some levy dollars. And Chris, you may have to jump in to help remind me of the source of some of this funding. So we don't want you to write your program to what is today, because we see this ramping up after the first of the year. We want you to be able to start planning, certainly, but we don't want to have you driven by the dollars that are available today. We will have additional dollars coming in to this process for the first of the year. We want you to write your proposals based upon the needs and your capabilities for driving a new program that is going to address crisis services in our community. I think our fear right now is that if people are writing to the dollars, what's available, then it's going to stifle your creativity as well as your opportunities possibly for collaboration and really building out a system that serves the community. If we have to stage the process for getting the services in place over the course of the next several months, we're definitely going to do that. We don't want to do anything that restricts. I'm sorry, my phone is doing other things. We don't want to do anything that's going to restrict your development of a program that serves the Montgomery County area. We want for you to build out something that meets the needs of the community. And one of the other ways for you to see some of what we heard is that we do have a summary of what our listening sessions yielded. If you'd like to be able to see that in order to build out something from your point of view, as opposed to being constrained by dollars that are available today. Sure, we could kick something into place today, but is that what we want ultimately? And it would not be.
So I also want to point out that in the chat, the COO of Goodwill Easter Seals, Jen Boniface, asked if it's possible to bid on a specific service component of crisis response versus the entire portfolio of services. The answer to that is yes, that is possible. So we are really looking for any and all ideas that you may have. And really, if you're only able to attend to one of the three or two of the three items, please go ahead and still submit an application. Bless you, Helen.
We do have a question coming from our boardroom, from a community member. Michelle, what is your question?
My question is, I came in a little late, so I apologize. So is there a summary of what we're looking for in the actual proposal, like an outline? Is it just based on what was on in the community meetings? Or is there a summary saying we would like these services provided, and then they do the proposal based on them being able to provide that for Montgomery County? I'm a little,
I will print a copy of the RFP for you, since I know you don't have access to the chat currently. I'll print a copy for you. We'll make sure you get that as soon as this meeting's over, so you can see that.
thank you. Thank you.
Welcome. Anyone else? Well, we are grateful for your time, and this video recording will be posted to our YouTube channel yet today. You all have the RFP. That will be posted to the website later today. And we welcome your questions to begin creating our FAQ document. And we look forward to seeing your great ideas. Thank you, everyone, for joining us today. Have a great day. Bye.
Thank you. Bye.